We're now live. Now, Megan?
So do you want to stop sharing, Megan? Hello, everyone. Hiya. Good morning, good afternoon, and good evening, wherever you are. My name is Santiago Ripoll, and I'm a research fellow at the Institute of Development Studies. I wanted to welcome you all to our first SHAP bilingual webinar. And today we are looking into community engagement in epidemic and pandemic preparedness. So for those of you who don't know SHAP, the Social Science and Humanitarian Action Platform, we are a research for action platform that aims to make social science operational in humanitarian action. So we bring together social scientists, like broadly conceived, including anthropologists, sociologists, political scientists, etc., and humanitarian practitioners together. And we do so to identify the key considerations to address ongoing challenges in emergencies. We are funded by the FCDO and by the Wellcome Trust. So this webinar also kickstarts a British Academy funded project on community engagement and pandemic preparedness, which focuses specifically in urban areas using ethnographic methods. Hopefully the lessons we share today will serve to make that research more precise and focused, building on your experiences. So in this webinar, we wanted to question what we mean by community, what we mean by community engagement across different contexts, particularly in relation to preparing for the next epidemic or pandemic, and with a focus on equity and justice. We wanted to look back to COVID-19, but also building on experiences before COVID-19 and ongoing challenges. So what we aim to address are the following questions. What do community and community engagement mean in practice and how it differs across contexts? What worked and what didn't in community engagement during COVID-19 in terms of equity outcomes? And what kind of community engagement needs to be already in place when the next epidemic or pandemic hits for an equitable response? Also, what kind of activity, community engagement is necessary to support pandemic preparedness activities, and what is needed to strengthen the role of national and civil society actors to support an equitable response? So we have 6 amazing speakers from around the world to aim to answer these questions. But before this, we wanted to reflect on how this builds on existing work at IDS and SHAP more broadly. Megan, whenever you have the chance.
Thank you, Santi. Hi, everyone. My name is Megan Schmitsane, and I'm a research fellow at the Institute of Development Studies, where I work on various aspects of epidemic preparedness and response, with a particular focus on urban areas. At IDS, several of us recently wrote a report titled Pandemic Preparedness for the Real World. In this report, we highlight the vast repercussions of the COVID-19 pandemic, not just for health and well-being, but in terms of the inequalities in that experience. We know that the costs of the pandemic have been unequally distributed both within and between countries. Pandemic preparedness plans proved inadequate in many settings, especially when it came to the most vulnerable, including those marginalized by geography, poverty, or exclusion along the lines of religion, ethnicity, or gender. We'll hear more from our speakers on this today. And of course, moments of crisis come with immense cost, but they also represent a potential opportunity if we can learn from them. So the report highlights how we need urgent action for pandemic preparedness across 5 priority action areas. First, by supporting health professional staff to be more flexible and able to respond to uncertainty. Secondly, by creating space for different forms of knowledge, including community voices, to inform policy action. Thirdly, by building resilience, particularly in the most vulnerable communities. Fourth, by strengthening our institutions so that they're more trustworthy and enable populations to trust in them again. And lastly, by embracing a new kind of epidemic ethics that moves beyond considering bioethics to also consider the wider context of societal issues, especially inequities in power and resource allocation. So as the report highlights, it will take effort from all of us, from communities to government institutions. And I'd now like to turn over to my colleague, Catherine Grant, to speak about this further. Thank you.
Thanks very much. I'm Catherine Grant. I'm a researcher at the Institute of Development Studies. And at IDS, we've been thinking about epidemic preparedness and the challenges of engaging with communities for many years. And I've been involved in working in community engagement and gathering contributions from communities over the course of several different disease outbreaks. A recent project, which began pre-COVID and continued throughout the pandemic, was the Wellcome Trust funded Pandemic Preparedness Project, in which we had local researchers living long-term in communities in Uganda and Sierra Leone, collecting ethnographic data and rich context-specific findings around their experiences of disease outbreaks, including how COVID compared to Ebola, and the learning gathered within the communities included information around vaccine anxieties, livelihood impacts, and the enforcement of COVID regulations. One particularly interesting blog from early in the pandemic focused on Uganda's villagers' use of the term disease of the radio to describe COVID as something they'd only heard about on the radio rather than actually experienced, despite restrictions being enforced. Other forms of community research can be done remotely and at speed, and this was evidenced by the work of the Ebola Response Anthropology Platform, which focused on providing rapid anthropological knowledge during the 2014 to 16 West Africa Ebola outbreak. Another example of this is the recent People's Agenda for Pandemic Preparedness, which pulled together learning from 25 countries across 6 continents by over 50 researchers to investigate what people need to recover from pandemics and how people think we should prepare and respond differently for the next pandemic. Whilst drawing across contexts give less specific findings, it gives the opportunity to see how different regions were affected and look for key issues affecting many places. Findings included the need to resolve systemic issues, ensure that the most vulnerable are supported, work with and involve communities for more effective response, and take pandemic innovations forward for the future. Such rapid research allows community research to be disseminated and used during outbreaks. Other past IDS projects include the 2011 to 2016 Dynamic Drivers of Disease in Africa Consortium. And my role in this was to look at the benefits of using participatory research and community knowledge in conjunction with traditional modelling methods to potentially improve disease research, control and management. An important outcome from this was showing how these forms of knowledge can be used in interdisciplinary research. And I look forward to discussing this with you further. I'll hand back to Santi now.
Thanks, Catherine. So probably we should have said this before, but just some house rules for how the translation is going to work. So first of all, I wanted to thank Umit Ozaidan and our translators Pierre Renson and Anna Gana and Danilo Seranik from Dragoman Translations. I also wanted to thank Gary Edwards and the events team, and also Annabelle Fenton and Joe Taylor for organizing the event. And then when you want to find your translation, in your screen, you will have a globe. And if you click on it, you'll be able to see what language you want your translation to be in. And you also have an option to take out the original speech. So it does either you can hear it duplicated, or you can hear just the translation. So hopefully you figure that out. And then just to ask the speakers to speak at a normal pace, just try not to hurry and try to speak clearly. And then one thing that is really important is to remember to change the channel when the speaker changes, because we're going to have French, English, French, English. And similar in the open discussion at the end, we're going to listen to the speakers, and then we're going to have an open discussion. So I'll ask for people to put their question in the chat and be patient, and we will come to it, and then you'll be able to intervene. And again, we'll just speak you to speak clearly and not too fast. So so we're going to start with Soamampirai Iyalijaona, who's a delegate in community engagement and risk communication for West Africa and the Sahel. And so, yeah, whenever you're ready. Yeah.
Thank you, Santi. Good morning, everyone. I'm Yanni. We are going to talk about community action and responsibility. So I don't know, Santi, si vous pouvez, could you please show my presentation? I'd like to share my PowerPoint with you. Just a minute. I still need to get connected. Santi. Are you okay? So we are going to talk about community engagement, preparation for epidemics. Can I go on? Yeah, we can see your presentation. Yeah, and we can hear you. All right. All members of the community, they are not all the same. They are very diverse if we want to talk about community. And within communities, there is a large span of capacities and risks concerning their experiences and their environment. And we can move on to the next slide. And the reference to the community. So in our work, community means a diverse range of people, including women, men, boys and girls, either disabled people, different ethnicities, and marginalized populations, and those represent the communities, the representatives of the community and authorities, and taken into account the different sociocultural specificities. We need to be aware of this when we address the term community. Next slide. Could we scroll down the slides, please? We have why should we engage the communities? That's the question we have. Why do we need to have community engagement? Why should we have community engagement?
On est sur le numéro 3.
We are on number 3, slide number 3. Yeah.
Okay.
Yeah. We hear
Thanks
you.
a lot. Mhm.
Thank you.
Alors, je voulais juste,
I'd like
parce qu'on a
to,
parlé de la
we have
communauté,
spoken about
et
community.
mettre en exergue le fait
So
pourquoi
I would like to
on veut
underline
s'engager avec les communautés.
the fact, why do we need to engage with the community?
Donc, je voudrais juste en fait mettre en exergue ces quelques points.
I'd like to go through these points.
C'est-à-dire le fait que nous devons nous
The
engager
fact
auprès
that
de
we
tous les groupes de
need to
personnes
engage with this group of people
pour comprendre leurs besoins
to understand
spécifiques,
their specific needs,
leurs préférences et leur
their
situation.
preferences, their situation.
Et personne ne connaît mieux la communauté que les
And no
personnes
one
qui,
knows better the community than themselves, community members.
lorsque nous nous appuyons sur cette connaissance et cette expertise
We
locale,
base ourselves on this knowledge, we
c'est pour
will
planifier.
be better prepared to give a response.
Et nous avons beaucoup de chance de bien faire les choses et de fournir
We
un soutien.
have a lot of chance to support these people.
Sans la confiance, les gens peuvent être
Without
susceptibles de ne pas
trust,
s'adresser à
people
nous.
may not feel free to come and see us
De ne pas utiliser nos services,
and use our services,
de ne pas croire les informations que nous partageons,
and to trust the information we share with them.
ou bien de ne pas accueillir les gens qui travaillent avec nous
Maybe they are not ready to host people who work with us
en toute sécurité dans leur communauté.
in full security in their community.
Donc, juste pour mettre en exergue
Just to stress out a few aspects,
parce que nous allons parler
we are
de
going to
préparation,
talk about preparedness.
que les personnes touchées par une crise ne sont pas
People
impuissantes.
affected by a crisis
Nous
sometimes are not ready to respond to it.
Mais nous avons besoin
We need
de renforcer l'appropriation et la résilience.
to enforce preparation and resilience
Elles
and
sont généralement
understanding.
les,
People
elles sont
are
généralement les
usually
premières à intervenir dans le
the
cadre d'une
first to take action in the context of an outbreak,
et possèdent des connaissances et des
and they
compétences
have knowledge and skills that
qui
can be
peuvent
very
garantir
useful and can ensure
une aide
an
pertinente.
adequate response.
Next slide, please. Et c'est pour cela que nous voudrions en fait expliquer un peu
we would like to explain
qu'est-ce
a
qui a
few
marché,
aspects,
qu'est-ce qui a
what
fonctionné
has worked
quand on avait effectivement
when
engagé les communautés.
we engage the communities.
Donc, la stratégie qui a le plus marqué,
The strategy that has worked the best
c'était celle qui était en fait,
was
qui se reposait sur l'écoute.
the one based on those communities
Ce qui se reposait sur l'écoute.
and based on listening to these members of the community.
Et
And
par rapport à cette écoute, il y a eu une communication à
concerning
distance.
this listening,
Cette communication à deux sens a permis
the
de faire des dialogues.
communication, the two-way communication has allowed us to have a better perception of the situation affecting these people.
Ça a permis de comprendre les communautés, comment
So
ils
we
perçoivent telle
understood
situation.
communities, what they were going through.
ça a permis aussi de prendre en compte leur suggestions et leurs capacités.
We could also take into account their well-being and use their skills to help build a better response.
Il y a eu aussi la collecte et l'analyse de feedback.
Had the collection and analysis of data.
Ce qui a permis de vraiment revoir
And
les
it
croyances.
helped us to review all the steps taken and results.
Comme les croyances, les craintes, les rumeurs.
As beliefs, fears, rumors.
Et ces informations ont vraiment
And
éclairé
those informations have helped us a lot and threw light on our approach.
Et ceci aussi a beaucoup façonné les stratégies
And
de
this has
communication.
shaped the strategies that we have implemented.
L'identification et la promotion des solutions.
The identification and promotion of solutions to tackle the situation.
Ça a permis de mieux gérer et encourager la participation active.
Managed the situation on the grounds of what we learned from the communities themselves.
Et si nous parlons de ce qui n'a pas vraiment fonctionné,
in terms of what did not work,
dans le prochain slide.
So next slide, please. We are going to go over things that didn't go that well.
C'est que il y a eu beaucoup de peur qui a été créée.
There was a lot of fear that has arisen among the people.
Et ça a été présenté ou manifesté à différents niveaux.
This has been seen at different levels.
Il y a eu par exemple la peur du nouveau vaccin, ses effets secondaires.
Fear of the new vaccine and of side effects.
Beaucoup de
lot of
réticence
fear and some resistance to take the vaccine.
Et la non-maîtrise de l'infodémie aussi a créé l'appréhension.
They didn't master infodemia and it created a lot of concern.
La fatigue pandémique est comportementale y compris.
And the pandemic fatigue is behavioral and it can lead to some difficulties.
Il y a eu beaucoup de retard aussi au début,
There
bien du
was a
tâtonnement
lot of delay in the response that has been given to the situation.
Il y a eu des incompréhensions concernant la poursuite des messages.
Misunderstandings also that did not help our task.
Et c'est encore le cas, par exemple, ici où il y a eu la fin de l'urgence sanitaire mondiale.
And it was the case when the health emergency stopped at a world level.
Mais si on passe au prochain slide pour parler
now,
de quel
on the next slide, we are going to talk about
les types d'engagement communautaire qui doivent
type of community engagement that
lors de la
needs to
prochaine
be
épidémie.
in place to tackle the next pandemic.
C'est plutôt une approche centrée sur les personnes.
And we prefer an approach centered on people.
Qui donne la priorité à la
That
compréhension
gives
des
priority to the understanding
des
of
capacités,
knowledge, of skills,
préoccupations.
capacities, concerns,
Ceci afin de permettre l'adoption des actions et d'améliorer
to
les
facilitate the
résultats
adoption of measures and to
et aussi
improve the results and the impact.
Une action équitable devrait se faire.
An equitable action needs to be taken.
Des approches intégrées aussi devraient être
Integrated approaches that need to be available.
culturellement appropriées.
That need to be adapted culturally speaking and need to respect gender equality.
La présentation de tous les
The
groupes dans la prise de
presentations of
décision
all
locale
groups in decision making at the local level needs to be a
doit être une
priority.
Préparer une réponse
And to
localisée.
prepare a local response.
Les actions menées au niveau local
Actions taken at the local level
et
for
trouver des
identifying
solutions
obstacles and to find trustworthy solutions are important to create efficient strategies for use and demand.
Miser aussi sur les données
And we need to invest on the updating of data.
Les outils adaptables permettent de recueillir
and those tools that can be adapted to collect reactions,
les feedbacks, les points de
vue and feedback,
pour instaurer un
and
climat
fears of communities to create a trust atmosphere.
Donc, on se demande en fait dans le prochain slide, qu'est-ce qu'il faudrait faire
the
pour
next slide,
renforcer le rôle des acteurs nationaux.
Should ask what can we do to enforce the role of national actors, national stakeholders.
Donc, dans cela, on parle
de civil society to support an equitable response.
D'avoir une cartographie claire des différents intervenants
to map the different local stakeholders.
Actuellement, on parle de plus en plus de localisation.
Currently, we talk more and more of localizing a need for donors to work with partners, local partners. And I would like to add, in our context, the need for local research,
giving
priority to the needs of those communities
qui s'appuie en fait sur les connaissances, les compétences
et les knowledge, skills and other local resources that already exist.
Ce serait bien aussi d'avoir un système qui assure
We should have a system ensuring a quick kick-off of the resources.
Et cela en premier lieu,
particularly human resources, to train voluntary workers.
Une prévision financière qui prévoit toujours en fait d'abord la préparation, mais aussi le déploiement. Ce serait une aide pour pouvoir en fait préparer les personnes locales. Je n'entends plus la traduction en anglaise, mais on a aussi besoin de documenter les passages de campagne, de savoir quelles sont les campagnes qui marchent et quelles sont les stratégies qui réussissent.
The campaigns that work well and the strategies that are effective.
Et je pense aussi que dans le dernier slide, on a d'autres domaines.
In this slide, we have other domains, general domains,
mais qui touchent l'engagement communautaire.
That have to do with community engagement.
C'est de renforcer les capacités globales de préparation aux épidémies.
To have capacity building within the communities.
Des capacités des sociétés nationales pour la Rouge, par exemple.
Building on those national communities.
Et dans des domaines plus techniques tels que les soins intensifs et la
in other technical domains, we need also to invest.
On devrait aussi renforcer les capacités générales.
And we need to have capacity building, generally speaking.
Le soutien dans la conception de programmes de santé
in the design of health programs.
Ceci pour pouvoir améliorer les messages et les
To
modalités de
improve
communication.
messages and the way we reach out to the people.
En améliorant les liens entre les services de santé de
Improving
communauté
the links between healthcare services
à base communautaire et les services de santé de proximité.
grounded on the community and health services.
Merci beaucoup à toutes et à tous pour
Thank you
l'attention.
all for your attention.
Thank you so much. Sorry, I wasn't getting the slides at the beginning, but that was really, really fascinating. So I'm going to ask the next speaker, Ngononi Dzashe Nyambawaro, to share his slide and start his presentation. Nyambawaro is a regional risk communication and community engagement search coordinator for East and Southern Africa for the UN Collective Service.
Hello, everyone. As just been said, my name is Ngoni, and I'm based in Pretoria, South Africa, supporting the collective service team for East and Southern Africa. So I'm going to focus on the support that the collective service has been giving to the different countries and the experience that we have had in terms of community engagement and how the different contexts we have seen the different collaborations that have been done in the different countries. So in brief, the collective service basically is a collaborative partnership to increase the scale and quality of RCC approaches, and it catalyzes and accelerates expert-driven, collaborative, consistent, and localized support for governments and partners involved in national response public health emergencies. And the lead partners for the collective service are IFRC, UNICEF, WHO, and the GORAN. But at country level, any partner supporting the government within the RCCE structure becomes part of the collective service. So we are promoting the collective effort or the interagency approach to RCCE support to governments at country level. In terms of the country support that we have given, we have supported country requests either in person or remotely for different public health emergencies or disasters, which covered COVID-19 routine immunization, EVD, yeah, that's Ebola, cholera, drought, and cyclones and floods. Some of the countries that were supported recently include Eritrea, training for the UNICEF and government RCC coordination structures on community feedbacks and social science. In Eswatini, Lesotho, Namibia, South Sudan, establishment of community feedback systems and social science support. In Somalia, supporting the community engagement and accountability task force on coordination and community feedback mechanisms and data synthesis. In Kenya, establishment of 4Ws partner coordination, data synthesis, and supporting planning of new programming as requested by the government. In Zimbabwe, community feedback mechanism setting up social science support, accountability to affected population coordination within the UN structure was also supported. For EVD preparedness, we supported the Uganda country response and all the countries that were bordering with Uganda. That includes all that have got direct routes with Uganda. That include Burundi, Kenya, Tanzania, Rwanda, South Sudan, just to name those countries. Then on SAGE support, where we actually deployed some teams within 72 hours We supported the Uganda Ebola response, the South Sudan cholera response, and ongoing North Sudan refugee crisis and Malawi cholera response, and the second thread. In the pipeline of ongoing support, we have Burundi, Zambia, Mozambique, in addition to existing country follow-ups. As collective service, our strategic priorities are supporting the delivery of the global risk communication and community engagement strategy. And to make this possible, the collective service works closely with 4 strategic priorities. We want to be collaborative, which is catalyzing collaborative RCC approaches to increase the quality, harmonization, and advocacy and optimization and integration of RCC. Then we want to be data-driven, that is to generate, analyze, and use evidence on community perspectives to systematically inform policy and programming and to improve effectiveness and efficiency. We want to be community-led, which is to improve the quality and consistency of the community engagement approaches. And we always want to reinforce capacity at national, reinforce national capacity for improved local solutions. I'm going to have a deep dive in terms of the community engagement through the community feedback mechanism, the listening approach, where we try to make sure that within the response structure, the RCCE pillar plays the central role of listening to communities and making sure that whatever programs or activities are being delivered, they take into consideration the issues that are coming from the community, the collaboration that we'll be doing to them, and we are doing programs according to their expectations. When you're talking about the community feedback system, what do we really mean? We're mainly looking at 5 types of feedbacks, which constitute all the different types that come from communities. So we've tried to categorize it according to anything that comes as observations, beliefs, or rumors. We classify them on what people think and are talking about. It may be true or false, or they could be a bit of both. Then we're looking at the different questions that comes from the communities, considering that in an emergency, there are a lot of questions that people would definitely need answers. So we also try to make sure that whatever questions are coming from the community, we give them platforms to ask those questions, and we'll be able to answer them so that whatever is not clear for them is clarified from a scientific and informed perspective. All the suggestions that comes from the communities, they are also being considered, which are ideas from the communities about how to tackle issues and what we could do better or differently. Then we also looked at incidences, sensitive and violence comments, which is observations or complaints about staff, the different field teams that we deploy, as well as commenting or comments highlighting security concerns. Then, as much as possible, if there are any things that the response teams are doing well, we also needed to record it so that we learn from that and keep on doing that. How do we ensure that we try to listen to the communities? The key important thing that we were looking at is to build trust with the communities. And how do we build that trust? Trying to understand the context and information needs, providing useful and actionable information, and engage the communities as much as possible. Then getting people's feedbacks and analyzing the feedbacks so that we actually know and we can easily act on all the feedbacks in a timely manner. Then once we do that, we act on the people's feedbacks and we accompany them to be part of the solution. As part of setting up the common feedback systems, we try to make sure that as much as possible within the organizations, there was management buy-in, learning about the community in terms of their priorities and preferences, then planning the feedbacks according to community preferences, training both the internal staff and the field teams that are deployed in the communities, and using different channels to raise awareness about the community feedbacks. Then as much as possible, we try to collect the feedbacks using different channels, using different platforms, where the issues that are brought forward by the communities can be answered. You can actually give the relevant feedback in that on site, but also all the feedbacks were recorded and they will be analyzed so that we understand the key questions, concerns, and rumors that will be coming from the communities. As much as possible, we share the community feedback with relevant community colleagues and stakeholders and partners. Then, once we are done with this, we take action and we adapt our program and we evaluate the community feedback system. What kind of engagements need to be in place for community feedback system to work? We noted that when we're working with the communities, we need to have standardized tools if we are having an interagency approach. And we need to have processes developed for COVID-19 adaptable for a range of public health emergencies. And this has been welcomed by the countries during and between emergencies. Doing a lot of context analysis, community mapping, to understand the community structures and how they function is very key. Then partner mapping so that we reduce duplication and we actually know that our coverage is supporting and doing our programs in an efficient manner. We developed the 4 Ws mapping where all partners who are supporting the RCCE pillar, they are mapped and it increases accountability and we are able to know who is doing what where. As much as possible, if the community feedback system is to work, we need to build trust, because once we build trust with the communities, then they are able to engage with us. They are able to ask. They are free even to communicate or report incidences, and they can easily propose how they would really want to be supported throughout the response. Getting buy-in and support from key stakeholders is very key, considering that this could be the gatekeepers and also from the community and the relevant partners. Deciding the scale of the feedback mechanism with the community is very important, because sometimes they can actually tell us realistic opportunities and realistic platforms which are reachable to them. Then we need to define the communication channels, using channels preferred by the community. And as much as possible, we try to map and design the information flows together with the communities. Identifying resources, both human and financial resources, because we noted that there is a lot of capacity within the community, but if we don't engage them, we will not know the capacities that are within the targeted areas. And we, as much as possible, we needed to capitalize and make use of those resources. Designing data management tools and processes together with them so that whatever tools we're using, they were context specific, they work for them, and the communities, if we design these tools together with them, they can easily identify themselves with these tools and they are able to use them at ease. Building capacity of the community to run the community feedback system is something that brings sustainability into the program. Then promoting the feedback mechanism within the community so that everyone knows its existence, everyone knows how to make use of it, everyone knows that it's a system that is safe, where if you share information, it's confidential, and you can easily get relevant support if you make use and if you put your suggestions into the community feedback system. Translation of feedbacks into action builds trust, because when we act on the feedbacks that have been shared by the communities, they'll actually know that whatever they're sharing with us, we will take relevant action and will answer the questions that they'll have asked us. We'll incorporate their suggestions. And it's not just a one-way process where they just feed information, but we'll also take relevant actions to improve the way we are programming, to improve the services that we are providing to them, and to make sure that whatever we are giving them is of expected quality. Then accessibility and confidentiality is something that needs to be maintained. And once they actually know that the system is confidentiality, everyone is happy to make use of it. I'll look at some of the examples of the feedback systems that we have developed in the different countries. In South Africa, we supported the KwaZulu-Natal flood emergency, where we supported conducting rapid assessments, training of local teams, supporting the community structures in information management systems, then setting up an inter-agency community feedback system together with the communities, then promoting the inter-agency coordination up to community level so that communities will actually understand the different partners that are working with them and how we are complementing each other. What has worked in some of these responses, how quickly an inter-agency community feedback mechanism can be set up with volunteers providing critical data across the response, real-time identification of the needs and actions prioritized, referred, and followed up within a very short turnaround time. The ability to adapt to the evolving, changing context of the response needs, informed by the community feedback data and recommendations developed on a weekly basis, was noted as very critical. In terms of another example, for the support that we have given to Malawi on cholera response and cyclone Freddy, the activities included building community capacity around how to generate and use community insights to shape the response efforts, using channels and approaches which are already working well for the communities so that we don't come and start putting in place new systems and not forcing partners to adopt new tools which are time-consuming and expensive, and sometimes they may never be used. Social science support, rapid qualitative data collection for COVID-19 and cholera. This was seen to be very effective because we closely engaged with the communities and we understood some of the issues that were actually making response operations a challenge, or communities not wanting to change the practices that were enabling cholera to spread. In terms of focus group conducted in Malawi, targeting cholera hotspots, like around in Lilongwe, to deepen insights from qualitative surveys and conducting rapid qualitative assessments in places like Mangochi and Salima for health-seeking behavior among cholera patients and their families, and the use of community management boards who are involved in decision-making, and they are always collecting insights or inputs from the people that they are representing and feed into decision-making structures for the response. What is needed to strengthen the role of partners? 4Ws mapping we've seen to be very key in terms of increasing accountability of partners within the government, together with the government, and ensuring that we understand who is doing what where, for how long, and with what resources will have been deployed. Active inter-agency community feedback mechanisms have been working well, where proper coordination system have been structured. Continuous capacity building in light of the changing context, especially for the community, so that they understand the different messaging, so that they understand how to respond in the changing context, is something that has been very beneficial and made communities always to be ahead of the pandemic. Community feedback mechanism, standard operating procedures, and relevant guidelines need to be continuously reviewed so that if we are deploying or if we are working with teams, we're always giving them documents that are current and guidelines that will enable them to be able to prevent themselves and also prevent their families and those who are around them. Active community feedback committees to timely analyze the data and produce timely recommendations are very key. Robust action trackers supporting all response pillars, something that has been noted to really work, and strategically position the RCCE pillar to be the ears of the response. Standardized tools to use in the field so that when we are deploying and collecting data, we actually know that the data that we're collecting is standardized and we can easily analyze it in a unified format. Tools for use, like having frequently asked questions that are standardized and approved by the government, clear referral pathway so that whoever is being deployed can easily refer, or we actually know where to get relevant support, and communities build that trust, knowing very well that if they put issues forward to us, we can either support them as a partner, or we can always refer to the relevant offices. Having standard packages is something that is key, so that there is a necessary competition among partners, so that we are deploying teams speaking with one word, and we actually know that whatever has been developed is shared across the whole RCCE pillar. Active RCCE pillar, which works closely with other response pillars, is something that is very key, considering that the RCCE pillar always needs to be the ears of the whole response structure. And advocating for RCCE as a priority pillar in every response, we have noted, especially in COVID, RCCE did not really receive the much needed support, but when the cases were rising, we actually noticed that people realized the importance of RCCE. So we definitely need, as much as possible, to advocate for the RCCE pillar to make sure it's also considered a priority pillar in the response. In terms of ensuring that community feedback system, the community engagement process is prioritized, this is what I wanted to share with you. Thank you very much.
Thank you very much, Ngoni. Really interesting, and we're quickly going to move on to the next speakers. And if you could keep to time, that'd be great. So we have Ashley Ivrier, who's a researcher at the Laboratory for Applied Social Sciences in Marseille, with Philippe Canot, Director of the Public Health Team in the City of Marseille, and Alif Rouleux, who's the Project Manager on Health Access and Mediation, also at the Public Health Team in the City of Marseille. So whenever you're ready.
Thank you. Hello, hello. Can you hear us? Yes. Yes, we see the PowerPoint. No problem. No problem. No problem. So I am a researcher in anthropology, and I've been working with Megan and Santiago in the crisis of COVID, but also with the people of the city of Marseille, Alex Auvrier, but also Philippe Canot, and Philippe Gagy, and Sébastien Azidi. What I would like to suggest, if you allow me, is to give you some element of the context in the political environment in France. We don't speak about community involvement, but we speak about in other terms with the actions that are undertaken by the discriminated communities, and with some also communities that are undergoing a lot of problems in the different area where you have problems, urban problems. And so I will give you some more details after on the city of Marseille. As I just mentioned, we speak in France the question of community and of this approach of community, this involvement of level of the community. It's not something that we understand clearly in France. It's not only a question of the translation. So we have always a different options as far as the, let's say, English or English speaking attitude. So we don't use this term or words because it's also a question of politics. So the model of management of immigration is done by the integration model of the migrants. As far as the community approach that the English-speaking communities advocate, and so like in the United States or in the English-speaking communities or in the UK. So we have more and more different, let's say, national or extreme right or right position as far as the politics are concerned. And if all the people of the same community reunite within the same context, they are anti-republican. So we have policies that are just managing the activities that are in line with the different options that we have. I'm going to introduce a short presentation of all what we have been doing, which is important. We have a culture of social struggling and social struggling against inequalities, and then I will give the floor to my colleagues. Is it okay as far as the translation is concerned? So in France, we spoke about a kind of dialogue, also the way we can work with our peers, and a dialogue that could be built, even if the question of the vocabulary is different for the community involvement. We have also other way to work on the health system. So we had a community system for the 1960s, 1970s, where a lot of doctors complained about all the inequalities of the system. And then we've been working with the workers and working classes and see how we practice medicines. And in the 70s and 90s, we had what we call women that were like a relay from all. It was also a way to be let's say an intermediary or go between person between the communities and the French national. And so we had to work on the rights of the people and the question that they had access to the French medicine. And these women were just being the go between person between the communities and the official system. And then we had as it was everywhere in the world, then we had also the main fight against AIDS in all the countries between 1980 and 2000, and see how we will discuss this and see how the fact that we can have let's say a dialogue and how activists could also intervene. And also we had all the different actions that were undertaken in the different communities or in the different area for the use of drugs, the use of discrimination linked to the mental illness. And so, and all this context is really important. That created in France in 2017 what we call a referential for a way of having a mediation in the health system. So it's something that is recognized as a profession. So you are a mediator between the people, and linked also to the idea that the health is going outside of the hospital, and we are not going to be discriminated by the system. And you have these women that are the go-between person between these communities. And then I'm going the floor to Alix, and she will explain how things happen in Marseille. And then we'll go to what happened during the COVID, and then I will come back to some other items and see what we could do in the case of a new pandemics. So I'm working with the city of Marseille. So I have got two goals. And I was also a mediator and a go-between person between the communities, and I've been working also in an association with people on the ground. And so when we saw this outburst of COVID, we worked with the different association in Marseille, and this was translated by all the different actions to go to the people and to try to connect to these people, try to show what were the inequalities in the different area, and especially about all the question of prevention and the question of identifying all the problems and the screening of the problems, and try to find what was happening during COVID-19. We had two projects that were really important in Marseille, but before going in too much details, or too many details, we are going to speak about the different associations that had been working with the hospital, with the health center, and that they just set up a new health centers in the north borough of Marseille. And they had the same opinion that we had some inequalities in these boroughs because we were confronted with a very poor population. So we had a dynamic which was really important. Some of these more vulnerable people were really hit by the COVID-19, and we didn't have the necessary social follow-up for them. And so we had to work with these people. We had a way to see how we could gap this lack of communication. And then after that, in 2020, we had two different projects that were set up, one by one association in the north area of Marseille, and that had also, they were militants and they were very happy, important at this level. And we had also a way to work on some doctors that were already involved at this level, and the projects at the level of a hospital in the south of the city that was working on the prevention and on the social policies at this level. In the two cases, we had also the collaboration of the health agency, and we had different modalities of actions. We spoke about in the different presentation, especially with a mapping of the territories and knowing exactly what would be the actions and how we could trace the people, how we could find them and identify their needs. And this is a project, this is really important with the territory approach. And so in 2020, we had Medinac, that was a new association that was proposing a possibility to have a screening for COVID tests. And it was really important for these two projects in Marseille, in the north and in the south and center. We were really involved at national level. And so the mediator at the, or the go-between person at the level of health system that are working in the different area are identified. And we will see how the different subjects would be tackled with these people that are specialized and then can speak better about the COVID-19 and about the different symbols and all the different trust that could be built with these communities, because they could have a real action as far as the health system is concerned. And so we had also different people working. They were speaking with different languages, and they were able to speak in different languages with the Arabic migrants, and of course they go to the go-between person that were speaking Arabic, and so of course the one coming from the Comor go to the go-between persons that were speaking their own languages. It was sometimes difficult to work with some communities because there was a barrier of the language. For the Rom community, it was much more difficult to find a common ground. And then we learned a lot of lessons at this level of the different project of mediation, and the way we could speak and find a go-between person to have a link between these people and the rest of the organization and the health system. The question of the equity and the balance is always sometimes very difficult, because we need to establish a dialogue with these communities who are prejudiced, and we need to work with the health system, but we need also to find a solution to level up all these inequalities in the communities, and it is too important. What is really important is to see what are these different projects that were set up to find a common ground. And even with the precarious situation and the absence of communication, we needed to have also the possibility to work with the different area at this level, and the possibility to have a work that is going to be done on the inequalities. And so we try to put and shed some light on these social inequalities in a common ground, and a certain will of the institution to work at this level with the city of Marseille, that we create a new office, and we discuss also the precarious situation in the different borough of the city of Marseille. Thank you so much. I will finish and answer one of the question of Santiago, you mentioned the question of this guide for this seminar. You said, qu'est-ce et je voulais, I wanted to be also near the people and find also how to level up the inequalities in the health system in the borough where you had a lot of problems, precarious migrant from the first, third, and second generation, and try to find a policy at national level that could be, let's say, in line, that is not going to repress people that could not be reacting to what happened, like what happened 3 days ago, or on Thursday, about what happened with these young people that was killed. we need to establish a climate of confidence because these people are really mistrusting the institution. And I know that in the different countries we are working, political aspects are at stake. And we need to understand that this is really tricky, and it can be a very tricky context.
Thank you very much, Ashley, and thanks for reminding us of that. I'm going to ask Maddie to share her screen.
Ah oui, merci. Je vais juste remettre la batterie.
Yeah,
Okay.
we can see it. Yeah.
All right. Great. Good afternoon, good evening, good morning, everyone. My name is Maddie. I'm a public health doctor in the UK and I work in West London. I'm here to talk to you about the topic of community engagement and pandemic preparedness, but with a focus, of course, on our experience of COVID-19 in West London in the UK. And just to note that all the views here are my own. So first of all, I thought I'd give you a little bit of context about Ealing. This is a London borough in the northwest of London. So on this map at the top here with the purple outline, you can see Ealing in the top northwest quarter of the London map. And we are a local, a London borough, a local government that serves 365,000 odd residents. And we've learnt relatively recently how our residents tend to identify in the 7 towns of Ealing. So in fact, Ealing splits up into 7 towns, 7 high street hubs, if you like, 7 residential areas. And that's how most of our residents tend to identify at a geographical level. I should note there are many other ways, and I'll go on to describe that when we talk about communities. But that's something we've learnt very, very relatively recently in our borough. We are a very diverse population in Ealing. We have the 3rd most ethnically diverse borough in England and Wales. And we talk about ourselves as a population around the concept of super diversity. So we aren't just diverse in ethnicity, but of course across that there's diversity in immigration status, there's diversity in labour market experiences, religion, gender, age, etc. And so that creates this kind of real super diversity within our 365,000 odd residents. And just as an example, we have 170 different languages spoken in schools. Ealing as a place is very rich in community assets. There are many religious festivals, many cultural festivals celebrated in the borough. We have many other community assets that are diverse and varying. We have a very large and strong voluntary and community and faith sector representing a huge number of different faiths and community groups. We are 87th out of 326 of the most deprived local authorities in England, so the local authorities being the geographical areas that a local government in England serve. And our inequalities in the population are vast as well. We have a life expectancy gap of 6.5 years for men and 4.6 years for women. And there are 19% of our households with no one who speaks English as a main language. We also have huge deprivation inequalities, and the deprivation is concentrated in 3 of our towns. So that's Southall, Northolt on the west side of the borough, so this dark red here on the second map, and Acton in the east side of the borough. So it's a very there's a high inequalities in our population, and deprivation is concentrated in those 3 towns. And just to give you a bit of historic context to the borough and the UK, I guess that's of relevance to this conversation. There's UK-wide, so there's central government and there's local government specific political, economic and social dynamics, which definitely played a part in the inequalities both known about before COVID and experienced during COVID. And some of that's to do with UK government's treatment of migrants and their rights and entitlements. Some of it's to do with data sharing agreements between police, education and the NHS, and the fear of legal consequences for certain members of the communities that we serve. There were also, of course, widespread histories of structural racism experience, like many other countries. And we have a particular economic history in Ealing, which I think is of relevance for COVID. We have Ealing's population serves about 30% of the food provision to the rest of London. So we have huge food industry in the borough, which employs a lot of people on kind of frontline workers, creating food, processing food, packaging food, and that's a huge part of one of the kind of occupational groups that were affected during the pandemic. We also have a huge number of our population working at Heathrow Airport, which is just next door in one of our neighbouring west boroughs of Hounslow. And we have many employees in precarious economies of the care industry, of hospitality industry, and many others. So hopefully that gives you a bit of context for when we talk about community and community engagement. So the local meaning for us, as I've mentioned, people have voiced loud and clear during COVID and since how they want to work at a 7 towns level in our borough, but that doesn't mean that people don't just identify with communities at a geographical level. That's one way in which they might identify with one of their 7 towns in which they're a resident. But because of our population diversity, I think we recognise that people identify with many communities due to the plurality of identities that they have and that intersectionality between those identities. So of course, as a human, we all will identify with many kind of aspects of our lives, our identities, our histories, and that plays out in our borough in the sense that people are a member of many, many communities. So depending on what you ask of those communities to talk about, to engage with, will mean that you get a kind of different mix of people involved, of course. And there have been huge trust challenges for us in Ealing and many other London boroughs and the UK regarding the way the local government or NHS or bodies in statutory positions have spoken about communities in the past. So also kind of difficulties in being able to just difficulties that we shouldn't just use the word community to flippantly talk about a group of people with a similar characteristic in which they might not actually understand that to be their community or the strongest one that they would identify with. Community engagement, so the context for us is that there was a huge amount of consultation fatigue. People were feeling that they'd been telling local government a lot of things when consulted over the years, and they'd heard little response and had little feedback, and a feeling that there was a lack of power and influence for them to be able to make change, but also that if they fed into one part of the system, that the system wasn't sharing that local insights, and there was a lot of kind of feeling of sort of silo working within the local government that was causing a problem for how we did community engagement or how community engagement was perceived. So huge amount of work going on at the moment and since the pandemic to really shake up the way that we do community engagement, the way that we understand good community engagement. And the current work on this whole area is much broader than it has been previously. So we're really stretching the system to think about community development models, to models that build on assets, rather than think about the sort of deficits and the gaps. And whilst becoming a bit of a buzzword in the UK, the concept of co-production, co-development, co-working is very central to the way we're doing community engagement in Ealing. In the same sort of way, the local government are pushing ourselves to decentralise power and control to communities. So rather than just engaging, consulting, discussing, we are thinking continuously about how we offer more power and control to communities to actually work with us, to take on accountability for work of the system. And that means that we're also looking at how we invest in community members and communities that identify as groups to in their sort of training and their skills to be able to work with that system well. Some of the examples of this I'll share a little later, but we've recently redeveloped a health plan for the local population for the next 5 years. That's a statutory thing that we have to do in England. It's called a health and wellbeing strategy. And we worked very hard on that strategy to ensure that its commitments and its now actions are increasingly around how the system works better with communities to create health and create health equity. There are some other examples listed there that I may bring into the discussion later. So where does all this community engagement happen and who does it in our borough? So we are trying more and more to go out to residents, and of course that's an obvious point, but the system, local government, NHS has been quite used to creating its own events and asking community members to come into those events and participate in those events. Actually, what we're trying to do these days is go to existing groups, existing networks, existing forums, meetings that community members are already hosting, and offer to engage with those events. So going to where people naturally group and gather to discuss important issues. We are perceived as a local government as knowing communities very well, and that's because, of course, we have elected members and councillors that serve our communities. But in other ways, we're also perceived as not using the wealth of intelligence we have sufficiently to affect the change that communities themselves would like to see. And we're increasingly doing more of this work through our key voluntary community sector and faith sector partners. So I think there are different perceptions and levels of experience within the council, depending on which bit of the council you've worked in. We in public health are quite accustomed to community development models, but there are parts of the council that are less used to and aware of the evidence base around community development. Having said that, there's been a lot of positivity from the engagement that's been going on around our local plan recently, which is a big plan that's done I think every 10-20 years around kind of development of space, planning applications, housing developments, etc. And there are new collaborations happening. So we're doing community engagement in a faith forum, so a forum of a meeting of a whole range of multi-faith leaders in the borough, and that came from COVID. So during COVID we worked very closely with a diverse range of faith leaders. We worked with groups at an area base, so rather than the 7 towns, and that's the level we will be working with soon, we worked at these sort of 4 areas that seem to naturally work for COVID. And we're also working very closely in partnership with our NHS colleagues, so our health system colleagues, now through other relatively new partnerships at the borough level that didn't exist before. And what really counts for us as community engagement is much stronger two-way conversation, spaces where power is more level between the system and the communities, and trying to break down those dichotomies and seeing sort of less of the them and us, but seeing all of us working together. We are trying to think about, you know, other ways of engaging, so that there is a lot of acceptability in communities of using online methods, but of course needing to be in person on the ground is also a really, you know, something we value and we think works best. And we're doing a lot of sort of workshopping, community engagement activity, which is less transactional and more relational than perhaps in past. Just mindful of time, but I have a slide here that's in our health and wellbeing strategy that tries to give you a sense of the kinds of community groups, assets, organisations networks that we work with, both at the voluntary level, the front line, some forums and structures which are more partnership kind of based, and some where we might be doing bespoke consultation for specific pieces of work. Just to speak briefly about COVID and our community engagement during the pandemic. So it was imperfect, but essential to the effectiveness of our response. Community leaders had a key role in sharing messages in culturally competent ways for their local communities. So messages were co-developed and delivered by trusted individuals in the community, and that was vital. And it was through these relationships that we had and started a much better two-way conversation, so we could have that crucial feedback loop where possible. And our relationship with our academic partners, the Institute of Development Studies, benefited our local understanding as they had researched and supported conversations with Ealing's communities about particularly vaccine hesitancy in the pandemic and more generally now health equity. And so some of these research findings have corroborated this learning about the importance of engagement, trust and relationships, and it's led to more project working. And we've learned how we need key structures for engaging local communities during the pandemic response. Some of those I've mentioned already are in the Faith Forum, area task groups, but also that the role of the job of community engagement wasn't and shouldn't be limited to our community engagement team in the council, but that actually it's part and parcel of all of our work in local government to ensure we're doing community engagement well. I think this is my last slide. So this is just to pick up on the question of what kind of community engagement we thought, well, I think needs to be in place for our potential next epidemic, pandemic, and what is important to support the pandemic preparedness activities. I've built these in together really. We obviously need to do community engagement really well. We need to do this by building up trust and relationships for the longer term with our communities. And we need to support the development and recruitment of specialist skills in community engagement, co-production and research within our council and including among community members themselves. And we need those structures that we used for engagement during the pandemic to be reviewed and where appropriate to be reintroduced or continued. And we're already doing a lot of that, but to look very critically at what worked well during the pandemic and build back in ways of engaging with communities now, so that we are having that continuous conversation and it's not just at the point at which we're in crisis mode that we reach out. Our emergency management plans need to consider how community engagement expertise can be brought in from a very early stage of a major emergency. So not just in the actual planning, actually engage communities in the plans that are set around kind of emergency management, but also at the very early stage of a major emergency, we need to mobilize those community engagement assets really quickly and work with them from the very start. We want to build on our ongoing research partnerships so that we have a better learning culture in the council, and that can actually inform the way we do community engagement more in the future. And we also strongly feel we should use the concept of proportionate universalism to guide us. So this is an academic idea from a professor of epidemiology in the UK, whereby to tackle inequalities, you need to do something universally, but also above and beyond that, for the proportionate to need, you need a more intense offer. So that's the way that you might be able to address inequality, and we can think about these principles even for community engagement. So ensuring that there is always a way that everybody could be engaged with or be informed and be brought into conversations, but also possibly and concentrate a more intensive resource on having a more in-depth conversation with those populations who we know are systemically and structurally and historically underserved by the system. We need strong partnership working so that community engagement is coordinated across both local government into our health system and our VCFS, our voluntary community faith sector. And it's why we built a new health and wellbeing plan for Ealing that's very much centred around community development and asset-based approaches. So I hope that's helpful. I will leave the last slide because this is really a bit more detail about our health and wellbeing strategy, but happy to provide the link to that to anyone who wants it afterwards.
Excellent. Thanks so much, Maddie. And excuses to everyone, because unfortunately the time has run out, so we're not going to have a chance to discuss with our panelists. But this is an ongoing discussion, so we'll be in touch with the presentations, and we'll be in touch with future work around community engagement and pandemic preparedness. And as well, we invite you to get in touch, to get involved with SHAP. So if you type social science in action.org, you'll be able to reach us. And also, I wanted to ask you if you could type in some of your feedback on the format. Is this bilingual kind of webinar interesting? Is this useful? Is this kind of format useful? Are there other themes that you'd like to cover in this, bringing across different languages? And I guess just to wrap up, so in a sense, we've heard from the four speakers, the 4 presentations, that there's very different priorities, very different actors involved in community engagement. There's very different processes, but within all of them, there's something about tailoring to diversity, emphasizing the importance of relationships rather than individual actions, having an attention to power, and the fundamental element of trust in building these relationships. And then that it has to go beyond the specific notions of community engagement, but broadly, everyone has a responsibility of community engagement, not just community engagement officers. And also there's a need to tackle structural issues when thinking about community engagement. So, and in a sense, to carry on a conversation when the times, when the epidemic isn't happening in preparedness, like there's a need for capacity, but also resources, and how these resources are necessary to aid in this community engagement for pandemic preparedness. So my apologies for having to finish now, and thank you all to all our panelists. It was really interesting, and yeah, and we'll keep in touch. So thank you, everyone.
Thank you. Bye-bye.
Bye.
Bye.